Hi, we're here to discuss back pain. Low back pain is a very common problem amongst all of us today, and it's important that we need what this is all about because prevention is really the best treatment for this entity, which is now spreading like the plague, if you may. So, jokingly, it is said that the world belongs to three types of individuals. One type is the one who are having back pain currently. The others who had a history of back pain in the past, and the rest who have not yet had it are the ones who are going to have it later. So, practically, all of us go through back pain in our lives, and we would those who have not had it would expect some back pain sometime in their lives. Statistically, it is said that almost 80% of general population goes through back pain, sooner or later in their life, which is serious enough to warrant medications or interventions also. So why is back pain so common? This is a cryptic slide which is printed a bit wrongly, but what it's meant to read is that our back is a very unique structure. Nature has given us a back which is meant to protect the nervous system within it. It's meant to give the basic foundation to the entire system in the body, including the internal organs, including the hands and legs, the skull, the brain. And it's yet meant to be a mobile unit. Leave alone the aesthetics. It's even meant to be mobile, strong, and yet harness the neural system. And hence, this combination of strength with mobility is the one that makes the back a possible weak link in our lives. And when we go through the structure of the back, you would understand what I'm trying to say. So the other problem is that you may be chilling out on a deck chair in Goa, but you're still loading your back. Your back is actually offloaded only when you're asleep or when you're lying down. So even in the position of sitting in the most comfortable positions, your back is, because there's vertical loading, the back is being loaded, and you really get rest to the back. And most of us, as you can see in this pictorial, tend to abuse our backs on a day-to-day basis, and we rarely service it. You would go to the gym and do dumbbells, you would lift weights to service your arms, you would run and walk to service your legs, but rarely service your back. And that seems to be bare, and that's where we start with this whole plethora of back pain. To quickly brief you about the basic structure of the human spine. The human spine consists of bones, discs, joints, ligaments, and muscles, and this entire harness, so to say, contains the nervous system. Uh, the basic bony structure is made up of 33 bones, of which the important ones are 7 in the neck, 12 in the thoracic spine or the middle back, and 5 in the lumbar spine. And then you have the single unit called the sacrum or the tailbone. This bony structure is made up of vertebrae, which are bones that are individual units that are linked together by discs. So these are discs, and these are the bones that have been are seen in the cut section. Uh, each of this unit contains one bone, one disc, and a bone again in the front. And behind, between the bones, you have the ligament and the joint, as is known as the facet joint, the hinge between the two bones. The alignment of the back, as you can see in an evolutionary human being, moved from an entire C-shaped curved to a double S curved as we started getting erect. And even within our own lifespan, we see as a baby in the womb, we have still a C-shaped back. And when we start crawling and holding our neck up, we get the first curve in the neck, and then we actually get erect and stand on our feet. The Homo erectus, so to say, gets the second S in the lumbar spine. So typically, it is a double S-shaped curve of the lumbar spine, and that aids the biomechanical stability of our back. Now, this entire structure of bones and discs and joints is then aided by what we call dynamic supporters, and these are the muscles. And these muscles are as important as the ropes that hold up the mast of a ship. So you can't have the mast of a ship standing alone if these ropes were not holding it up together. And there are several layers. There are 4 essential layers of muscles in the back. They are as important to us as the abdominal muscles in the front, and as the muscles of the pelvis and glutei and the hamstrings, which in a composite manner support the back. So this entire muscular strength of the back is really the key to success when you're treating back pain, because what changes happen in the bones and the discs are typically irreversible, while muscles can be built even in older age groups and even in any situation. So back to that mobile unit that I was discussing, there is a bone, a disc in the middle, and the bone behind, and that is the joint which actually is the hinge. Now this disc that you see between the bones, this structure here, is like a jelly, and it permits movement. It's free in 360 degrees of movement, and that's not good because this unit actually contains a nerve. So if you twist the back to a 360 degree, the nerve could really get damaged, and the joints behind, they prevent this excessive movement. They just allow a movement to a restriction so that the nerves are still protected and there's no no neural damage. So there's controlled movement where the disc takes part in maximum mobility and the facet joint restricts the amount of movement that happens there. Now as yeah the neural system in the back consists of the large spinal cord, which goes right through the middle, and at every level it gives out smaller nerves, which are the nerve roots, and these supply to specific areas. So the nerve roots from the neck supply to the hands, the ones from the chest supply the breathing mechanism, and the ones from the lumbar spine supply the legs. So the entire appearance is like that of a Christmas tree, as you can see in the picture on your right. That's how the spine would look in a model on an X-ray and on the MRI. So what you would notice is on the X-ray you only see bones, and whether the disc is good or not you have to decipher from how much space there is between the two bones. For example, the space between these two bones is significant, but here the space is reduced. So here the problem with the disc. The MRI is really a pictorial, or is the real true evaluation of the anatomy of the back is on an MRI, where you actually see like a model on your left. You see the picture on the right where you can see bones, you can see discs in the middle, and you can see the entire nervous system going down through the middle. So the MRI seems to be the gold standard for investigating and trying to find out causes of back pain. Incidentally, back pain can come from various sources, so it's not really restricted to the bone or the muscles. Back pain can even, from this slide, as you can see, can come from referred sources. Like you can have back pain from due to some problem in your liver or in some abdominal system. You can have back pain in your menses. You could have back pain because of blockage of blood vessels. You can have backache which is of psychogenic nature. So just like you get a tension headache, you can get a tension back pain. Amongst these, the top three are the ones that we want to focus on, if at all, in the following few slides. Back pain coming from bones, the primary cause today is osteoporosis. So weakening of bones would be the common cause of back pain that comes from the bones. The other causes would be weakening of bones because of pathology, like infection or tumor, where the bones start to crumble and then you would get back pain. That's not so important for you to know, but osteoporosis, certainly a quick refresher of osteoporosis. Our bone actually in a cut section is made up of columns and beams. These columns and beams run in a crisscross manner and they are arranged very densely to make the bone a strong unit. It's a pure engineering principle to have this in this manner rather than have this as a solid block, because solid blocks tend to crack more. This is a much better load bearing system. Now as we grow older, these beams and these columns start to dissolve, and you have less beams and less columns in a given area, making your bones porous, and this makes the bone weaker, and that's what is known as osteoporosis. Typically in a lady who attains menopause, there is a lack of estrogens, which makes the body lose more bone, and of course the bone forming factory stops by the age of 28 or 30. So here you have a bone stock that is being depleted on a triple or four times the rate that is acceptable, and that causes osteoporosis in women more commonly. And today we have excellent medicines that are available to treat osteoporosis, but no matter which way you look at it, no matter what medicine you give, the real good treatment of osteoporosis is prevention. So make sure that your kids, before being fully grown, are engaging in the correct diet and correct exercises, so they load bones adequately and supply enough raw material so that their bones become strong by the time their growing age disappears. So they are left with a good bone stock, and off which they can live off for the next 20-30 decades. We'll skip infection and tumors, it's not important to us. Coming to discogenic back pain. So discogenic back pain is back pain that comes from the disc. So discogenic means coming from the disc. Now this is very important because I would say 80% of people, white collared people that come to our clinic with back pain are people whose pain is started from the disc. Now this disc, just to give you a brief orientation, is like a jelly that's been tightly packed in a plastic casing. And this jelly has a lot of water content, making this entire unit a hydraulically charged unit. So when you press it down, it'll press you back. When you twist it, it'll twist you back. It has a great memory. So it serves as a shock absorber and allows movement between bones. The problem is that as we grow older, merely by usage, not necessarily by age, but because of bad use and bad genes, the jelly in this disc starts to dry up. And a dry jelly means that the disc is now lost its turgor, lost its hydraulic tension, and hence when you load such a disc like an old piece of foam, it tends to collapse upon you. And this is really the basis of spondylosis, where there's a vertical instability between the two bones. The two bones were meant to be held apart adequately. Now they tend to buckle on loading, and when they tend to buckle on loading, naturally there's a lack of buffer and the bones start to wear out. There's a wear and tear between two bones. The joints behind start to subluxate or dislocate. They malalign themselves, and most importantly, the nerve that travels between the two bones starts getting crunched for space, and you start getting problems related to spondylosis. Now, this is the first part of a disc pathology or a disc problem, and this is what we call a disc degeneration. It's the first part of the cascade of a discogenic back pain. The next part is where the nerves get compressed, and finally, the disc, which is now loosened up, if it keeps getting overloaded, can actually break down, and parts of the disc can actually escape the place where they're meant to be, the load of the body, like squeezing a toothpaste and the toothpaste bursting out. And this hits the nerves which lie in close proximity to the disc, and that causes pain down the leg, also known as sciatica, from the nerve that it impedes on, called the sciatic nerve, SCIA, sciatica. And uh, that is really a red flag, because once nerve compression happens, you have a potential of losing strength other than sensation in the legs, and you really need to act on it fast. And really treating this is best done when you're in the stage of degeneration rather than slip disc. Having said that, once this disc comes out and starts irritating the nerve, in practice, more than 90% of people will respond just to time. You don't need anything else, just counseling and time, no medicines, possibly bed rest. Even the evidence for or against bed rest is really not been established. More than 80% of people, just with time in the first 3 or 4 days, respond because of the body adjusting itself to this problem. And really, you want to get this supervised by a doctor to make sure there are no red flags. So if you have sciatica going down the leg, you want to get yourself checked. But more often than not, your doctor is going to ask you to just take some time out, take it easy. It makes sense to rest, so you don't want to keep loading on the injured back. But typically you come out of it, and it's really what you do after that is what's going to determine what's going to happen to you in the future. Because though recovery is almost a rule, recurrence is clearly a rule. I mean, everyone who has a slip disc is going to have another, and then a few more, and then ultimately may not recover. And hence, once you're better from your sciatica, it's really when our expertise, so to say, comes in, and we need to guide you on what we call back rehabilitation, to make sure that there's no recurrent injury on the disc, so that in future the disc doesn't keep buckling and coming out. So you have to reinvent your physical lifestyle. We'll discuss that if there are any questions in the future, in the further course of this webinar. But it's really reinventing your lifestyle to make sure that that bad or injured disc is kept out of harm's way, so you don't keep on injuring it and keep on getting sciatica, because each time you get a sciatica, there's a chance that it doesn't recover. And you don't want to flirt with surgery in a situation where you normally don't need any surgery. um, so activity modification, posture modification, weight control, and exercises, we'll dwell upon it if there are any questions in the later part. This really is the long-term treatment of the slip disc, and only 10% statistically of patients with slip disc and sciatica actually need an operation, and these are people who don't respond to conservative treatment. With quality of life issue, we choose surgery for them, and others who, because of the nerve pressure, develop weakness in the nerve, they may need a surgical intervention so that you save their nerve from harm, and so to say, protect them from paralysis. Spondylosis is the next step of a degenerated disc, where now, because of the lack of buffer between the bones have started rubbing against each other, causing arthritis of the joints of the back. And like this slide depicts, all of us will grow older, all of us will grow wiser, and all of us will get spondylosis. So spondylosis is really an aging phenomenon which may or may not affect you and your quality of life. If your demands on your back are much more than what your back permits you, you may come back with back pain. Or if your spondylosis unfortunately is rapidly advancing because of a past injury or because of a bad genetic disposition, you may have symptoms. So mostly spondylosis can be managed by again the lifestyle that you lead. If you have excessive spondylosis, means more than what you can handle for your lifestyle, so the joints of the back have worn out just like the knee joint and they are giving you back pain, uh, that's the time where you want to take care of it by using injections or exercises or other things. In a rare situation where because of this wear and tear the nerves in the back start getting entrapped, again this would be maybe 10 or 7 or 8% of the entire gamut of spondylosis that you see. um, that's when you really would need a surgical correction and surgical decompression of the nerves to give you a give you a better quality of life. So the dictum on back remains clear, that the only ones that really have a good surgical outcome or need surgery are people with essentially leg symptoms and less back symptoms. The real treatment of back symptoms is rehabilitation and getting your back on track, losing weight, getting exercises, etc. So I hope that is very clear that surgery is associated with spine only when legs are involved, and not getting better without surgical maneuvers. The red flags you want to see, so if someone has a back pain and you don't know whether this is serious or not, if it's associated with leg pain, numbness in the leg, weakness in the leg, rest pain, so even on lying down this person has pain, or if it's associated with systemic symptoms like fever, weight loss, you want to then visit a doctor before you draw your own conclusions. So those would be the red flags. A quick single slide on what to do when you have an acute back pain at home. So you're sitting in your office and you just twisted your back to pick up the file from the desk behind you, and there was a catch in your back, and your back got locked. This is what you call an acute lumbago, and typically it's a sprain in the soft tissue of your spine. Because it's so close to the nervous system, you want to deal with it more robustly than you deal with an ankle sprain. More so because in the ankle you have the other leg to hobble on and you can still walk, but in the back you don't have on the back. So whatever you do, you're loading on an injured back. So I think the number one thing to do is freeze and not stress, and not to make awkward movements to try and release this back catch, because the back catch is going to go away once it heals, rather than you doing maneuvers. By doing maneuvers, you're going to only cause secondary injury. So if it's frozen in a particular situation, try and be in that position. Rest in a position of comfort, not necessarily in bed. Local heat will help a lot. So in the back, even in an acute situation, heat helps rather than ice, compared to other superficial joints where you normally ice it for the first 48 hours. Avoid local massages. Local ointments will help. So some muscle relaxants can help. And typically, be within your confines. Don't challenge that spasm, and it normally goes away within 24 hours. The rest of the slides we need not actually address right now. If there are any questions which are specific to posture and back pain related to pregnancy, we could take them. Um, because more than general knowledge, this is rather specific entity. But typically the message I'm trying to give you here is that if you keep your back in good health uh, before you start getting back pain, so have good habits, have have a healthy lifestyle. I mean, everyone tells you that, but specifically speaking, from a habit perspective, all of you guys who sit on office chairs and work, remember, this is the right chair. There's no magic formula for everyone. Each one needs to have the chair that suits him the best. So the height of the chair, the way you sit in it, the armrest, a back support which makes your back sit with the curve rather than collapse in a concavity. uh, Avoid slouching. These are all the standard rules of sitting. Similarly, when you lift, don't bend, lounge down and lift, but lower yourself, get the object close to you and then stand up. That's a much better way of lifting, so you can protect your back. Try to work close to your body than away from your body, as you can see in these pictures. As wherever possible, keep the area of work close to you. Try to have a little footrest where you can distribute your center of gravity and make the back a little, move out of the equation of load bearing. Sleep in any comfortable position, no big deal. But when you get up, don't get up with a jerk, because your muscles are still asleep when you get up, and the back is going to be injured if you don't warm up a bit in bed. Stretch a lot, turn around on the side, and get up from your sides as far as possible. Um, Specifically, there is not much role of bed rest. So there were times when people would take 3 and 4 weeks of bed rest for back pain. That is really now a garbage philosophy, as so to say. There's no evidence for it, and you probably make yourself worse. There's a very limited role of using belts or using special action kits or using special beds or pillows. There's not much role of that. Um, there's a good role, or there's a good evidence to suggest that if you're exercising yourself regularly, whether it's walking, swimming, cycling, or specific back exercises, you're possibly going to have a less chance of getting a back pain in the near future than others. Keep your weight at its minimum. Keep your tummy as flat as possible, because a tummy that hangs out tends to load the back more and predisposes you to injury. Make sure that you have the right diet, so a lot of proteins and a lot of especially calcium in vegetarians, because we tend to miss calcium in a vegetarian diet. Make sure there's adequate sunlight exposure, especially in the growing age group. A brisk walk like 30 minutes, 3 kilometers, 4 or 5 days a week would be a good, good generalized comment as far as general exercises are concerned. And a good daily routine of exercises to strengthen the back, doing some easy ab crunches will really have your back covered, and you will need less and less of us guys. I'll thank you, and would be happy to answer questions if there are any. So Chetan says, I'm having a problem of gastric ulcer, but because of it I get severe pain in the back. How do you deal with such pain? So Chetan, it's a very relevant question. If you have a gastric ulcer, stomach actually sits right on the spine, and any pain that comes from the stomach is reflected on the back. This typically is a pain in the mid back that tends to move along the sides in the girdles. It typically gets worse when you've eaten something, and or it's food related, and if your doctor has done a gastroscopy and confirmed that this is a gastric ulcer indeed, you should not bother about treating the back, but treat the gastric ulcer. And the essential treatment of gastric ulcer, which I'm not an expert at, is taking adequate antacids and eating the correct type of bland food at the correct time intervals. And don't bother about treating your back with exercises or belts, because that will probably worsen the situation. So if you're sure, Chetan, that your back pain is coming from, or you have a gastric ulcer sitting there, you may want to neglect the back and get your gastric ulcer treated, which is going to sort your back pain also. The Sorry, I'm going to try and get the next question. Mm, uh, which is the next question? I think my brother used to go for, so Tejas wants to know, my brother used to go for swimming. He started getting back pain. We went through a series of tests and the doctor suggested an MRI, CT scan and blood test. Later we detected that there was a tumor in the L3 region of the spinal cord. We did bone marrow biopsy, and reports said that it was non-malignant. We started with a series of radiation. The radiation is finished. Doctors say his spinal bone is porous. The doctors say they will fill the area with cement and put a clip. Now there is some problem here, Chetan, because if the tumor is, I'm sorry, Tejas, there's some problem here because if the tumor is non-malignant, radiation is not the treatment of this tumor. So clearly there's a misunderstanding. You use radiation treatment only in malignant tumors. So get that clarified from your doctor. Now, what your doctor must be trying to say is that this is a good malignant tumor which responds to radiation. So don't consider it as bad C or the bad cancer, but consider it something that we can treat well. And these are typically plasmacytomas, myelomas, lymphomas, which come from the bone marrow cells of the vertebral column, and they make the bone weak. More often than not, after radiation, the entire thing turns around if it's a radio sensitive tumor. So the strength of the bone gets restored, and you don't have to back it up with cementing. There are a few situations where radiation eats up the tumor but leaves the bones porous. Now, this is a very personal kind of a thing. It could be right for your case, but it may not be right for everyone. So, if we trust the doctor and the doctor says that the bone is left porous and he would like to fill it with cement, this is a preventive maneuver to prevent the bone from collapsing. So, what is done is that after radiation, the tumor has gone away, the bone is left hollow. You in under local anesthesia, while saying, while chit chatting with the patient, you put in a needle, maneuver it through bone without hurting the nerves, and inject liquid cement which fills the spaces of this bone and sets it right, so it will prevent or preempt a collapse. And this is a procedure called vertebroplasty, which is an excellent procedure, and in the right situation it can really save you from a problem coming up. But according to me, in the bulk of cases, if it's a radio sensitive tumor and radiation has been carried out, your bone is left back as strong as it is, and you really don't need to do vertebroplasty. On the other hand, you may want to check proteins, check calcium, check vitamin D, and give a systemic therapy to strengthen bones in general. So I'll be happy to, if I have case histories, then I can, specifically tell you if there is anything else about about your brother's condition. Of course, swimming has got nothing to do with it. And all the best for your brother to get well soon. That's it for now, right?